My purpose of being here today is really to provide just a little bit of background and what I would call is kind of termed a little bit of a history lesson that highlights some things that that are not only that I believe are to be practically important, but are highly relevant to the information and so on that Mike is going to share today. And so with that, I did want to have a bit of a disclaimer that this history lesson, and hopefully that, especially for some of the younger folks in the audience, it provides a little bit of perspective, but the history lesson is just simply my recollection and interpretation of some of my experience and observations since working across the North American pig industry over the last 20 years. And one thing I've gained by the last 20 years is now I have to use glasses to read, so maybe that's a rite of passage, I'm not sure. So a little bit just about PRRS history, lesson 101. We're now more than 30 years of PRRS being alive and well in North America, and we're approaching just north of 20 years since the first PRRS MLV vaccine came into the marketplace in the U.S. And it's been about 15 to 16 years since the advent of using herd closure as a cost-effective and repeatable mechanism for eliminating PRRS virus from breeding herds. And that really work started just around the turn of the century with Monsi and PIC and Bill Christensen and that whole team there that really were the first ones to kind of bring that technology, which is now commonplace, into the system. And after the principles for using herd closure to eliminate PRRS from breeding herds was understood, there came a large wave of large-scale PRRS elimination projects that were initiated both in the seed stock and commercial breeding herds. And it was shortly after that we quickly began to better appreciate how vulnerable these PRRS negative herds were to reinfection from something other than PRRS infected pigs or PRRS infected semen. And I also wanted to take this time just to many acknowledgments to all the work that went in around getting the PRRS cap and all of the accompanying industry sponsored research and support that really helped fuel many highly collaborative public-private research collaborations. Researchers and practicing veterinarians work together, which has really have driven a lot of the knowledge that exists today. And the findings from this broad array of PRRS transmission research that really ensued really shortly thereafter the turn of the century, coupled with recurring field observations of PRRS virus lateral transmissions events that were occurring really set forth a previously unprecedented investment in biosecurity related infrastructure and protocols that collectively aim to reduce the risk of lateral transmission of PRRS into swine farms. And most of these investments were largely made, or have been largely made, around protecting boar studs, breeding herds, and gilt replacement sites. And these investments included more truck washes, the advent and use of truck bakers, the transfer stations, easier to wash trailers, and more biosecure mechanisms for disposal of dead stock, more biosecure and systems and protocols for getting people and tools and equipment into farms. And it also helped drive a notable migration of breeding herds further away from pig dense, or what I would say finishing pig dense, areas of the country. And last but not least, it drove the advent and application of air filtration that began in boar studs and then has been expanded into sow units and now even some gilt development units. And most of that technology has been being applied in the upper Midwest. And along the way over the past 15 years, there has and continues to be many significant improvements in the diagnostic tools and the associated applications that are being implemented en masse on a daily basis across the North American pig industry. 2 additional PRRS MLV vaccines have come into the marketplace, along with a number of non-MLV or otherwise killed PRRS vaccine options. And I think I'd be remiss not to acknowledge the very recent and exciting scientific breakthrough of PRRS-resistant pigs that Dr. Prather shared with us at this meeting last year, of which I think we are all hopeful that this promising finding may one day provide another commercially viable option to help mitigate the effects of PRRS virus and improve the health of pigs and productivity of pigs throughout the world. While so much progress has been made, as we sit here today, December 2016, PRRS is still the most consequential and infectious disease impacting the health and well-being of pigs and the cost of production in North America, if not throughout the globe. And in short, that is why most of us are here today in Chicago. Unquestionably, PRRS has influenced the structure and composition of North American pig industry and continues to have a highly significant impact of both how and where pigs are being produced today. And while the introduction of PDV into the U.S. in 2013 and the subsequent sequela of events that followed brought about a myriad of learnings concerning the disease transmission in the U.S. swine industry, the research efforts conducted by Jim Lowe, Dr. Connor, Yeske, Lula, and DeFriends that Jim shared some of that earlier today, really shed great light as to how much cross-contamination of livestock trailers is occurring at the interface of the trailer and the unloading dock at the slaughter plants. And this work strongly suggested that unsanitized trailers returning from slaughter facilities may likely be a highly significant amplifier of PDV and the unintended consequences of dragging virus back from slaughter plants to unsuspecting groups of susceptible finishing pig populations that are more than capable of amplifying the virus in great numbers. And these late-term finishing breaks of PDV, commonly associated with transportation events, also revealed the risks of high volumes of virus being shed late in finishing has on the subsequent groups of wean pigs that are being placed into those same wean to finishing facilities, and most notably in the winter months. And it seems highly probable that the same type of inter-herd transmission associated with finishing pig live haul is also occurring with PRRS that Jim alluded to earlier. And albeit the clinical consequence of such infections of PRRS in growing pigs can often be less clinically obvious and or delayed from the actual point of infection. And I think that's what the differences between the clinical onset of these PDV infections that were occurring that were really clinically obvious and notable after grades were being taken out of houses can be quite different than that of PRRS, that the clinical outbreak is much more obvious in the case of PDV and maybe more subtle with PRRS. And so with that, and now finally circling back to where I started and hopefully how all this rambling relates to some of the work that Mike is going to present today. And while I clearly understand there are differences amongst the various strains of PRRS and that in individual farm settings that now can require much more extensive closure periods to successfully eliminate PRRS virus using conventional herd techniques, but very generally speaking, I would say and I say we from a collective standard of practice as being of the North American pig industry, have felt generally confident in our ability to readily and cost-effectively eliminate PRRS from standalone breed-to-wean farms for the past 10 to 15 years. However, the challenges and risks associated with the subsequent reinfection of wild-type PRRS via lateral transmission into breeding herds via something other than PRRS-infected pigs or semen continues to be the primary hurdle that stands in the way of larger-scale PRRS control and or elimination efforts. So two logical questions. If PRRS can be so readily and cost-effectively eliminated from the breeding herds, who and where is the reservoir? Or asked another way, where is PRRS actively circulating, evolving, mutating, and being shed in mass quantities? And the answer to these questions, by and large, is, of course, it's in the growing pig populations. The answer seems all quite logical, as the growing pigs represent something north of 90% of the living domestic pig population. And in closing, I would suggest that even after 30 years, there are many remaining questions and opportunities to improve upon the status quo of how we are actively managing and are controlling the shed and spread and inter-herd transmission of PRRS virus most notably in commercial grow finished pigs. And I would also suggest that perhaps it is appropriate to think of the much larger mass of this commercial growing pig population as the primary reservoir for subsequent introductions of virulent PRRS virus into breeding herds. So with that, thank you for the invitation, and I'll turn it over to Mike.